Today we are going to talk about cervical lymph node groups. What does that mean? That we are going to talk about the lymph node groups which are present in the neck, right? I will not discuss the lymph node group which are associated with the head. Generally, we study lymphoid tissue in head and neck, but I will specifically today focus with the lymph node groups in the neck. Now, when we talk about different lymph node groups in the neck, they are basically classified in two ways. One way is that there is traditional classification, right? In traditional anatomical classification, I will basically discuss that different lymph node group in the neck, how they have their anatomical placement along different anatomical landmarks, right? And that is usually what most of us have learned previously, right? That is traditional. But these days, there is a modern classification which is being used now, especially by surgeons and radiologists, and that is Robin's classification, in which we divide the lymph nodes of neck in 7 groups, 7 levels basically, right? So we will discuss number 1, traditional anatomical classification of cervical lymph nodes, and once we are done with that, then I will discuss with 7 levels of Robin's classification, which is modern one, right? So let's go with the lymph node groups in traditional way, right? I will start from here, right? And I will start from here, and let me draw a diagram that, let's suppose here is your beautiful face, right? You look at your eyes, you know, and here you are, right? Now, actually, there is a lymph node group which is exactly here under the chin, right? In this area, right? Basically, if I draw jawline like that, right? Then we can say there are muscles, here is a muscle, yes, there's hyoid bone here. This is hyoid bone here, and yes, there's digastric muscle here, anterior belly of digastric, right? And then there is posterior belly of digastric, and it is going on both sides. Anterior belly of digastric and posterior belly. Now, just in between the anterior bellies of digastric muscles, right? This is digastric muscle, the anterior belly, right? In between that, this area, right, there's a group of lymph nodes which is present over here. This group of lymph node is called submental group. What is it called? Submental group. So we will write here, okay. Classification I will discuss later, but here I'm writing about the, but how I can write there under that 7? Submental group, okay, we write it here. Submental group of lymph node, right? Submental group of lymph nodes. I will not talk about the drainage. First, I'm going to do just anatomical placements, right? So this is submental group. Then we move from here laterally, right? And here we reach at the jawbone, angle of jawbone, that is, and here is submandibular gland, and just superficial to that, at these points, there are lymph nodes which are called submandibular lymph nodes. What is this group? Here, submandibular lymph nodes. These are submandibular lymph nodes. Now we have 2 groups. One is submental, right? And other submandibular. Now, just under the chin, between the anterior belly of both digastric, in between we have submental. Yes, say loudly. But between the anterior belly and the posterior belly, and at the angle of the jaw, superficial to the submandibular gland, there is a group of lymph nodes which are called submandibular lymph node. Okay, this was easy. Now, once we have discussed this, then we have done this, we have done this. Now I will come to the basically superficial cervical lymph node. Then I will go to the deep cervical lymph node and other. Let's discuss superficial cervical lymph nodes. Now, superficial cervical lymph nodes, they are basically very superficial under the skin, and they are superficial to the sternocleidomastoid, right? Why I say specifically? Because deep cervical group is along the internal jugular vein, and superficial group of lymph node in the neck, that is along the external jugular vein and interior jugular vein. Now here is interior jugular vein, here it is interior jugular vein, and here it is external jugular vein. Now the lymph nodes which are around the interior jugular vein and external jugular vein, again I repeat, not internal jugular veins, right? These two veins are superficial. Which one? Interior jugular vein and external jugular vein. There are lymph nodes around that area, along these veins. That is, those are called superficial lymph node. So we have done submental group, right? Then we have done here submandibular group, and now I was talking about superficial. This was submandibular group, and then third one which I discussed with you was along the which veins? Yes, we can say here is interior jugular vein in the neck, and here is external jugular vein, right? Now these are, what is this called? Superficial, yes, cervical lymph nodes. Now, few words about superficial cervical lymph nodes. There are other names also for this. Superficial cervical lymph nodes are also called pericervical lymph nodes. They are around the superficial area and around the neck. So, pericervical lymph node. This is the other name for superficial cervical lymph node. Then a very special name is also sometimes used, that is external Waldeyer's ring. What is that? External Waldeyer ring. Now let me explain this Waldeyer's ring, because there is internal Waldeyer's ring also, right? And very commonly in vivas or in MCQs, they check your knowledge about the Waldeyer's ring. When someone says just Waldeyer's ring, that person means actually internal Waldeyer's ring, right? When we say what is Waldeyer's ring of lymphoid tissue, that means internal Waldeyer's ring. But I will tell you what is internal Waldeyer's ring. But this superficial lymph nodes which are along the interior jugular vein and external jugular vein, this is called, number one, superficial cervical lymph nodes. Number two, this whole group is called pericervical lymph node. Number three, this is called external Waldeyer's ring. But here I would like to mention about internal Waldeyer's ring or just Waldeyer's ring. That is extremely important. Every doctor must know. Let me show you here your beautiful nose and your tongue, and yes, must be your eyes, and I hope you understand this diagram. I'm going to explain internal Waldeyer's ring, or when people say just Waldeyer's ring, right? That is lymphoid tissue which is very deep in the neck, right? Or oropharynx region. Let me explain. Actually, not really in the neck, that is above the neck. And here is you have ears, isn't it? Okay, you have some stars also here made of gold. This is external ear, there is middle ear, and from the middle ear there is Eustachian tube. This is your Eustachian tube, right? I don't know how to make beautiful ears, but let's suppose you have ears like this. Your ear is happy because it got value and got drawn. Now, exactly number one, there's lymphoid tissue which is in the, what is this area? Yes, please. This is nasopharynx. Look, this area is whole pharynx, right? Out of this, this is behind the nose, this is nasopharynx, right? Behind the oral cavity, there is oropharynx, right? Oral cavity behind oropharynx, and this is all oropharynx. This is nasopharynx, and this is oropharynx, and this is hypopharynx, which is behind the larynx, right? And of course, below that, there's you have your very important tube, esophagus, and in front of that you have your tracheal system. Now this is your epiglottis. Anyway, now there's one group of lymphoid tissue which is present at the nasopharynx here, right? This is called adenoid group also, adenoid lymphoid tissue, right? And this is also called nasopharyngeal tonsils. Then this is Eustachian tube which connect the middle ear with the pharynx, and there is some adenoid, there is some tissue around it, right? This is called, what is this called? Tubal tonsils. What are these called? Tubal tonsils. This is also lymphoid tissue. Then there are these, this is the palatine tonsils, right? On the lateral side, on both sides, you have palatine tonsils. Then under just here, this lymphoid tissue, in posterior part of the tongue, right? This is called lingual tonsils. What are these called? Lingual tonsils. Now, this is side view. Here I have shown you 4 groups. What is this? Adenoid group of lymphoid tissue, then tubal tonsils, then palatine tonsils, then there is lingual tonsil. Now, if we see the frontal diagram, then what will happen at the top? Let me draw it here, the frontal diagram. That if here is nasopharynx, here is oropharynx, there is hypopharynx. I've made a section here. If you see that here is adenoid tissue, here on the side is this tubal, and on the side of the this is palatine, and here is lingual, right? This makes a ring which is deep. How is this ring is made? At the top of my nasopharynx, there is adenoid. Suppose behind this. On the side, there are from the ear coming tubal tonsils. When Eustachian tubes are coming, and where Eustachian tubes are opening in the pharynx, around that there is what? Tubal tonsils. And then tubal tonsils, and then you come down, right? And on the side of the, you can say, posterior part of oral cavity, on right and left both sides, we have palatine tonsils, and then posterior part of the tongue, lower that has lingual tonsils. Now they make a ring, right? This is internal Waldeyer's ring or simply Waldeyer's ring. Now, this is not the part of cervical lymph node. But why I taught you? Because I was mentioning that there are superficial lymph nodes and they are sometimes called external Waldeyer's ring. So I just wanted to tell you there is something very important, that is internal Waldeyer's ring. And if someone asks you what is Waldeyer's ring, just talk about internal Waldeyer's ring, because internal Waldeyer rings is generally mentioned just as Waldeyer's ring, right? Now, we come back. How many groups? What was this? Submental group? submandibular group, then there was which was superficial cervical, which were along the anterior jugular vein and external jugular veins, right? And which was superficial cervical lymph node, also called pericervical lymph node, also called external Waldeyer's ring. So 3 groups we have discussed, right? Now we go to the next group, and next group is deep cervical lymph nodes. So let me draw deep cervical lymph nodes. Deep cervical lymph node, I will especially now talk about lymph nodes along the internal jugular veins, right? Here we are showing the internal jugular veins, right? This is, what is this? Of course, these are arteries. Which arteries? Carotid arteries. Carotid arteries, right? And they should be within a sheath, and that sheath is called carotid sheath. And carotid sheath has medially, what is this? Carotid, common carotid artery, and upper part internal carotid artery. Now here it is carotid artery system, carotid arterial system, then lateral to that there is internal jugular vein. And of course within the carotid sheath there are some nerves also, which I will not discuss now. But one very important thing which we should discuss now is that deep cervical lymph nodes which also run along the length of internal jugular vein, right? Internal jugular vein. And of course these lymph nodes are within the carotid sheath. Now we are going to talk about deep cervical lymph nodes which are running along the internal jugular veins, not external, internal jugular veins, and these lymph nodes are within the carotid sheath, right? Now these lymph nodes are divided into 3 groups, right? Suppose one group here, right? This is upper group, then or superior group, then there is second group which is middle group, and of course then there should be inferior group or lower group. Now this group of lymph nodes, again I am repeating, it's worth repeating, this group of lymph nodes, which is that many lymph nodes running along the internal jugular vein, right? And they are within the carotid sheath, right? These are also called jugular lymph nodes. They are also called jugular lymph node. We can call them deep cervical lymph nodes because they are deep within the neck, or now we call jugular lymph nodes. Now these jugular lymph nodes are divided into 3 main groups: upper or superior jugular lymph nodes, middle jugular lymph nodes, and inferior jugular lymph nodes, right? Now what we really say that upper jugular lymph nodes, they are along the upper third of the internal jugular vein, and middle group is along the middle third of the internal jugular vein, and lower group is along the lower third of the internal jugular vein, right? So again, now if we talk about, here are the internal jugular vein, now we go into deep dissection. Internal jugular veins, in upper third of the internal jugular vein we have superior jugular lymph nodes. In middle third of the jugular vein we have middle jugular lymph nodes group, and with lower jugular internal jugular vein we have inferior jugular lymph node group, right? This is one way to look at it, but actually more accurate way is that we should take some fixed landmarks, right? Like landmarks which are bony landmarks or cartilaginous landmarks, right? Which can be palpated even. So superior group, that is basically extend from base of the skull underneath, under surface of the skull is called base of the skull. because internal jugular vein is going up to the skull, right? Now, superior group basically can extend from base of the skull up to the hyoid bone. Let me draw there, or okay, I draw here. Your beautiful ears again with some ornaments. Now, this is what? Base of the skull. Now, here is internal jugular vein going, right? And here is also internal jugular vein going. Now, base of the skull, we come down from the base of the skull, here is hyoid bone. So, I will draw it here. This landmark is basically hyoid bone, right? Now, the lymph nodes which are present where? Along the internal jugular vein and which are located below the base of the skull but above the hyoid bone, that is the exact group which is called superior. What is this? Superior jugular lymph nodes. Yes. Right. So now we can say, when we talk about deep cervical lymph nodes, right? Deep cervical lymph nodes, we have divided it into, yes, superior jugular lymph node, middle jugular lymph nodes, and inferior jugular lymph nodes. Now, what I really want to explain here, come back to this diagram. The superior jugular lymph node, first of all jugular lymph nodes are along the internal jugular vein. Don't confuse it with the external jugular vein or interior jugular vein, because external or interior jugular veins have superficial lymph nodes, cervical lymph nodes. Deep cervical lymph nodes which I am discussing here, they are along the internal jugular vein, and superior group is extending from the base of the skull up to the hyoid bone, inferior border of the hyoid bone, and also we can say that is along the upper third of the internal jugular vein. Then from here to the cricoid cartilage. Here it is, suppose cricoid cartilage. Cricoid cartilage is here, this is a ring, basically part of the larynx. This is cricoid cartilage. I will write cricoid cartilage. Write this one. Now, lymph node group which is between the lower inferior border of the hyoid bone and up to the inferior border of cricoid cartilage, this lymph node group, right? This is basically your middle jugular lymph nodes. These are middle jugular lymph nodes, right? Then now I will position the inferior jugular lymph nodes. They are, here is your manubrium and sternum, and you have a beautiful clavicle also, I know, beautiful collarbone. I'm not that good in diagram, but still you can imagine there is collarbone there, right? Now, the inferior group is along the lower third of the internal jugular vein, and it is this group of lymph node is present below the cricoid cartilage, and above the clavicle, right? So in this way we have divided the deep cervical nodes, which are jugular nodes which are along the internal jugular vein into three groups: upper group, middle group, and lower group. Right? Now, few important points. One important point which I want to highlight, in the upper jugular group, there is one lymph node which is very important that you should know. I'm bringing it out. This lymph node, yes. You know why this lymph node is so happy? There must be a reason for that. Because it has a special name and it has a special importance. Right? In upper jugular nodes, there is a subgroup of lymph nodes, even one or two or three, maybe only one, that is very large. That is one of the largest lymph node in the neck, and that is physiologically large, right? Not pathologically. Now, this is called basically jugulo-digastric lymph node. What is this called? Jugulo-digastric lymph node. Now, jugulo-digastric lymph node is on both sides. Jugulo-digastric lymph node here, I will enlarge it, and jugulo-digastric lymph node here. Why we call it jugulo-digastric? Because of course it is along the jugular vein and digastric muscle is coming here and then going up. So also related with the digastric muscle. Now, this jugulo-digastric lymph node, there are few very important things about it. Number one, you must remember that generally speaking, when we have enlarged lymph node, we say there is some pathology. We say there is lymphadenopathy or pathology of the lymph node. But jugulo-digastric lymph node is normally physiologically larger than other lymph nodes, right? And this is one thing. So it's not always pathological. And second important point about jugulo-digastric lymph node is that it drains palatine tonsils. You know, tonsils deep, palatine, tonsil, they mainly drain into jugulo-digastric lymph node. And right, so tonsillar lymph node, when someone talk about palatine tonsil drainage, lymphoid tissue drainage, of course, you will talk about at least, first of all, if you just average doctor, average student, you say it goes to neck lymph node. You're a little better, you will say it goes to deep cervical lymph nodes. More specific, it goes to upper group of jugular lymph node. But super specific should be when someone asks you where the lymph drains from the palatine tonsils, because palatine tonsil or tonsillitis is very common, so I thought at least this drainage I should mention, right? So if you want to be very specific, then palatine tonsils, okay, I will make palatine tonsils here, palatine tonsils, and their lymphoid tissue drainage is yes to jugulo-digastric lymph node. Jugulo-digastric lymph node. It is part of the superior jugular lymph node group, right? So this was something very important. So I wanted to highlight. What was it? Which lymph node I mentioned here? Jugulo-digastric lymph node draining the palatine tonsils ipsilaterally, and it is usually the largest or one of the larger lymph node present in the cervical region, right? Number one. Then we come to the middle jugular lymph node group, which is here it is this one, but if you come here it is this one, right? Here also there is one lymph node which is very, very important. Okay, it is not really large, but it is very important. I will make this lymph node with red color because it is associated with some dangerous thing. What is this group? Middle jugular lymph nodes. And this lymph node, I have enlarged it. Here the most important was jugulo-digastric, okay, which are extremely important. I will make them red. Here it is another very important in the middle jugular lymph node. This is Why it is so important? Because this drains, this enlarges in many cases of cancers, metastasis, right? Oral cancers or pharyngeal cancers or laryngeal cancers, right? Very frequently, they love to have their metastasis in this lymph node, which is part of the middle jugular lymph node. This lymph node is also given a special name. And what is that special name? Its special name is jugulo-omohyoid lymph node. Jugulo-omohyoid lymph node. So here it was jugulo-digastric lymph node. In the upper group, middle group, jugulo-omohyoid. Jugulo-digastric should be remembered. Usually it is larger than the other cervical lymph nodes and it drains tonsils classically. And in the middle group, you must remember jugulo-omohyoid lymph node, which is very important because it many of the metastases from the oral cancers, especially from the floor of the mouth, from the pharynx, right, and from the larynx, and even from from these areas, cancers love to come. Even thyroid cancer, they love to come to this lymph node. But when I will talk about thyroid cancer, there is another lymph node which is very important, that is Delphian lymph node, that I will discuss later on, right? So now we have discussed what? Middle. And then inferior jugular lymph nodes, that is of course the lower group, right? Here one. Now, how many groups we have done? We review this, then we move forward. Number one, what is this? Submental. What is here? Submandibular. Superficially along the external jugular veins, interior external jugular vein and interior jugular vein and external jugular vein. What is this? Pericervical lymph nodes or superficial cervical lymph node or external Waldeyer's ring. And when we think of external Waldeyer's ring, you should automatically remember, yes, internal Waldeyer's ring, which is basically lymphoid tissue, which is guarding the nasopharynx entry and oropharynx entry and taking the sample of air and food antigens. If there are some antigens going through nose or from the mouth, so there is lymphoid tissue which is present here, air coming, and this can be sampled by the lymphoid tissue if there are antigens or bacteria or virus, right, by palatine tonsil. This is adenoid with adenoid tonsils, then on the side tubal tonsils, and then from guarding the back of the oral cavity, there is what is this? Palatine tonsils, and just above the posterior 1/3 of the tongue, right, in the tongue, the lymphoid tissue is present, which is called lingual tonsil, and they make a ring. How is this ring? Yes, on the back of the nose, in the nasopharynx. What is that? Adenoid. Then on the tubal tonsils coming from here. What is this? Tubal tonsils, of course. And then here are palatine tonsil, and under the tongue, that is lingual tonsil. So internal Waldeyer ring guards immunologically, basically entry of gateway of the nasal gateway entry and oral gateway, right? Now we come back. But this is not part of the cervical lymph nodes. I just mentioned because I don't want to confuse external Waldeyer's ring of the superficial cervical lymph node with their submental, submandibular, then superficial, then the very important group, this one along these, right? That is deep cervical lymph nodes, right? Along the internal jugular vein present within carotid sheath, right? Lateral to this whole group is lateral to the carotid artery. You know why I'm saying this, why I'm specifically saying that this group, jugular group, is lateral to the carotid artery and along the jugular vein, because there is another group of lymph nodes, cervical lymph node, which is medial to the carotid artery, and I will talk that later. That is called inferior group or central group of cervical lymph node. We'll discuss later, right? But you just remember that jugular lymph nodes are lateral to the carotid artery along the internal carotid artery. Again, I'm reviewing it because students forget it. So there is superior group, which is from the base of the skull, up to the hyoid bone, and then there's middle group, which is from hyoid bone up to level of cricoid cartilage, and then inferior group or lower group from lower border of cricoid cartilage up to the clavicle. Now, most important lymph node in upper group was jugulo-digastric, drainage for tonsils, usually a larger lymph node. In the middle group, the most important was jugulo-omohyoid lymph node, and it is very notorious for receiving the metastasis from many cancers in related area, from the drainage area, especially cancer from the floor of the mouth or pharynx or from the larynx, and even thyroid. Now, after these groups, we go to the next. Next group is posterior cervical lymph nodes, right? Next group is posterior cervical lymph nodes. So, posterior cervical lymph node are basically in the posterior triangle of the neck. Posterior triangle of the neck on the side. What is this muscle? Sternocleidomastoid. Posterior side of the back, posterior border of the sternocleidomastoid. And what is this muscle? Trapezius. Anterior border of the trapezius, and here is clavicle. This makes the posterior triangle of the neck. Posterior triangle of the neck. So posterior triangle of the neck also has lymph nodes, right? Posterior triangle of the neck also has lymph nodes, and these lymph nodes are divided into upper group and lower group, right? Upper group because spinal accessory nerve crosses posterior triangle. Okay, let me draw. I will draw the posterior triangle. Posterior triangle, as I said, say that it is from, let's suppose here is your manubrium and clavicle, and here is, which muscle is going here? Sternocleidomastoid going, and what is here also? Sternocleidomastoid, and basically here is trapezius, which is going, right? And in between these trapezius. Now, interior border of trapezius, this is trapezius. Interior border of trapezius, right? And I think here. And posterior border of sternocleidomastoid and upper border of clavicle, right? This makes a triangle. This triangle at the top, they converge to attach with the base of the skull, right? This is posterior triangle. Why it is laughing? Because it is getting attention. It's ladylike behavior, right? So, lymph node here in the posterior triangle, there is upper group, right? There is a spinal nerve crossing here. Okay, there is a nerve which is crossing here, spinal accessory nerve. So, there are some lymph node across it, right? This is upper group, and then there is another group which is in the lowermost area here, right? Now, both of them are called posterior cervical lymph nodes, right? But lower group is very important. It has one more name, that is supraclavicular lymph nodes, because here is supraclavicular fossa. So this lowermost group of the lymph nodes of posterior triangle of the neck, right? Or lowermost group of lymph nodes of posterior cervical lymph node group. Posterior cervical lymph node group, the lowermost group is supraclavicular lymph node. Now, supraclavicular lymph node, I would like to mention some important thing. Listen one thing. In this lecture, I'm not discussing in detail the drainage area of the lymph nodes. I'm just placing the lymph nodes, right? Mental, submental, submandibular, then upper jugular, no, first superficial cervical, then upper jugular, middle jugular, lower jugular, then we go to posterior triangle, the upper group in the posterior triangle and lower group in posterior triangle. Lowermost group is just above the clavicle or behind the clavicle, and that is, you can say, in the supraclavicular fossa, that is called supraclavicular group of lymph node. A supraclavicular group of lymph node are very important, right? Why they are important? Because as a medical person, there is a big difference, huge difference in their drainage area of the right group and the left group, right? Why? Because the right group of supraclavicular lymph nodes, right, they are connected with the lymphatic drainage from the right arm and right upper thorax and right side of the head and neck. But supraclavicular lymph node on the left side, supraclavicular lymph node on the left side, I have not drawn, okay, I draw there. This is on the left side, supraclavicular lymph node. This is upper and this is lower. Oh, one of them is very, very dangerous lymph node. Oh my God. Rather that lymph node, I should make it out of the left supraclavicular lymph node. One lymph node is very important for us, and if this is, yes, this lymph node, right, this lymph node, which is member of the supraclavicular lymph node on the left side, this is extremely important. Why? Number one, this is called varicose lymph node. What is it called? Varicose lymph node. I will write it here. We were talking about which group now? Posterior cervical lymph nodes. Out of that, I said there is upper group, which is along the spinal accessory nerve, and then there is lower group, which is supraclavicular lymph nodes. Out of the supraclavicular lymph node, one lymph node is very important. I will draw here. Oh my God, it's very, very important. This lymph node is called varicose lymph node. Varicose lymph node. Now, why I'm talking about varicose lymph node? This is varicose lymph node. This is not present on the right side. Rather, of course, on right supraclavicular lymph node there are many, right? But one of the lymph node or one subset of the lymph nodes which are part of the left supraclavicular lymph node, that is called varicose lymph node. They have very special clinical significance. But before I go for clinical significance, I will tell you that this side of the lymphoid, here thoracic duct drain, which is major lymphatic channel, right? Thoracic duct drain in the left subclavian vein, where left subclavian vein is meeting the internal jugular vein. So thoracic duct is coming here. These lymph node, varicose lymph node, are connected with the thoracic duct. Now thoracic duct drains the lymph from both lower limbs. Everyone has two legs. So both lower limbs, and from the pelvis, and from the abdomen, and from the left part of the thorax, left arm, and left half of the head and neck. So huge part of the body, lymph eventually collects and drains into thoracic duct, and thoracic duct eventually, thoracic lymphatic duct eventually drain at the jugulo-subclavian junction, and lymph is added to the venous blood. But at that very junction, okay, let me show it here. Wow, it is internal jugular vein pose, right? Here is left subclavian, right? Left subclavian here and internal jugular here. Here is what coming? Thoracic duct. And thoracic duct is draining into this area. Thoracic duct, right? At left subclavian vein at the junction with internal jugular vein. Now, here some lymphatics, they are connected with the varicose lymph node. They are connected with the varicose lymph node. Now what happens? Actually, if the cancers, carcinomas from its drainage area, especially carcinomas from, if you start from lower part of the body, we can say testicular carcinomas, ovarian carcinomas, renal carcinomas, right? I'm going to tell you the carcinomas which can make their metastasis in varicose lymph node, right? Now, what are these carcinomas? If someone asks you, tell just one cancer, right, which is gold standard answer, that is gastric cancer. But actually, many cancers drain into this area and produce metastatic deposits in varicose lymph node. And when varicose lymph node is enlarged due to metastasis, when varicose lymph node is enlarged with the metastasis, it is usually large, painless, non-tender, firm or hard, and fixed. In supraclavicular area, on the left side, if you find a mass or a large lymph node which is not painful, if there's large lymph node here, pray that it should be painful because it might be infection. But if it is not painful and it is hard or firm and it is fixed, this is big red flag. It is telling you some cancer from pelvic area or abdominal area or left thoracic area or left side of the head and neck is present in the body. And when this lymph node becomes enlarged, right? This lymph node becomes enlarged, hard, non-tender, and fixed. It means most probably there is metastatic deposit in it. And a very, very sad news. If you find a metastatic deposit in varicose lymph node, usually it is stage 4 for the cancer. Because it means that cancer has spread from its primary area to the regional lymph node and even beyond that, and through the thoracic duct, it has reached up to varicose lymph node or some of the lymph node or one of the special lymph node on the left supraclavicular lymph node. So finding a hard mass here, firm mass here, but painless mass and fixed mass is a very big red flag if you palpate in this area such mass. Why? Because it signals that metastatic deposits here. Now, if you have to remember one cancer, just remember gastric cancer. But actually there are many cancers which can give varicose lymph node pathology. And remember, when varicose lymph node become enlarged, non-tender, firm or hard and fixed, This is called Troisier's sign. What is it called? It is called Troisier sign. What is it called? Varicose lymph node. And varicose lymph node, when it become pathologically enlarged, firm to hard, non-tender and fixed. This is called, what are the spellings? T-R-I-E-R, T-R-O-I, yes, S-I-E-R, Troy, T-R-O-I, Zier, S-I-E, Troisier's sign. So when varicose lymph node enlarges, but it is painless, non-tender, firm, you must be saying that I'm getting mad, I'm repeating so much, but it's worth it. I want to hammer it in your mind, right? Especially in your gray matter, cerebral cortex, right? Troisier, when it becomes pathologically enlarged, firm to hard, non-tender and fixed. It is Troisier sign, red flag. How many? One cancer, if you have to remember, is gastric cancer. But let me tell you how many cancers actually can enlarge it. If anyone with, let's start from lower part of the body to upper part of the body, that testicular cancers, ovarian cancers, kidney, renal cancers, even if you come colorectal cancers, pancreatic cancers, usually adenocarcinomas, right? Gastric cancer, of course, you should not forget. Hepatobiliary cancers, even pulmonary cancers, breast cancers, and cancers in left side of the head and neck, left half of the head and neck. So this was a very important point related with left supraclavicular lymph nodes having a special lymph node, which is varicose lymph node. When it is pathologically enlarged, fixed, non-tender and firm or hard, it is Troisier's sign, right? So this is one thing. Then we come to another group of lymph node. Let's review so we clear the clutter. Submental group, submandibular group. Then we said about superficial cervical group or external Waldeyer's ring. Here the superficial lymph nodes are usually along the interior jugular vein and external jugular vein, right? Then after that we went to deep cervical lymph nodes of that group, which is along the internal jugular vein, where we said upper group, special important, jugulo-digastric, draining the tonsillar, draining the palatine tonsils. Then there is middle group, which is specially omohyoid lymph node. Many cancers of oral area or pharyngeal area or laryngeal area drain here. Then the lower group. After these groups, then we come to lymph nodes in posterior triangle, right? In the posterior triangle, upper lymph nodes which are along the spinal accessory nerve. Then lower group are supraclavicular on the right side and also on the left side. Left side has special lymph node, we call it varicose lymph node. It may be one lymph node or small subset of lymph nodes in left supraclavicular lymph nodes, right? And this varicose lymph node, if it is enlarged, non-tender, firm to hard and fixed, this is called Troisier's sign. And this is a red flag because it most probably patient has cancer and that is stage 4 cancer, right? We have discussed this group. Now we come to another group, and this group is the lymph nodes which are medial to the carotid arteries and below the hyoid bone. Look, in this area, below the hyoid bone and above the, what is this? Notch, suprasternal notch. Now I'm talking about exactly in the lymph nodes in the midline. These lymph nodes which are present in the midline, and they are also a group of deep lymph nodes, right? These deep lymph node in the midline or paramidline, these are called central group of lymph nodes, central group of cervical lymph nodes. The central group of cervical lymph nodes, they are always medial to the carotid artery, right? Number one. In upper extent maybe up to hyoid bone, and lower up to sternal notch, and even behind that, up to sternal notch. Now this central group of lymph node, this has one lymph node or one group of lymph node just in front of the cricoid cartilage, right? Suppose here it was your larynx, and this is cricothyroid membrane, and just in front of the cricoid cartilage. This lymph node is very sad because this lymph node receives, if it gets enlarged and painless and firm and hard or fixed, right, we think of thyroid cancer, right? And this is called Delphian lymph node. What is it? Delphian. Basically, this is just in front of, what is this? Larynx. So we call it pre-laryngeal lymph node, right? This is part of the group of central lymph nodes, right? So central lymph node, if I draw here thyroid gland, okay, I draw here, this is hyoid, what is this? Cricoid, then here should be thyroid. But this diagram is better. Here is your thyroid, right? Now, just above the thyroid, this lymph node group, I'm just showing one, but there may be more than one. This lymph node group is called Delphian lymph node, right? They are clinically very important, especially they are sentinel lymph node for thyroid cancers. Sentinel lymph node means that thyroid cancer, first of all, commonly involve this lymph node, right? Now, this is location-wise, anatomically, this is part of the central lymph nodes, and to be exact, it is pre-laryngeal lymph node or pre-cricoid lymph node, right? So, central lymph node, superior most group is pre-laryngeal or pre-cricoid lymph node called Delphian lymph node, and it is why it is so important. Very commonly, it can receive the what this metastasis from thyroid cancer, which thyroid cancers love to spread through lymph node. That is papillary thyroid cancer, not follicular thyroid cancer, right? Follicular thyroid cancer love to spread, prefer to spread through hematogenous spread, right? But papillary thyroid cancer love to spread through lymph node first, right? And, the primary route of spread is lymph node. So papillary cancer and medullary cancer, or of course if there is a highly anaplastic cancer of the thyroid. But if you want to remember just one thyroid cancer which involves the lymph nodes, just remember papillary carcinoma of thyroid, right? So Delphian lymph node, a pre-laryngeal lymph node, is taken as a sample or fine needle aspiration to look for the metastatic or to look for the cancer cells if they have spread here or not in case of thyroid malignancy. Then there are lymph node in front of the trachea, right? In front of the trachea. And what should be these lymph node called? Pretracheal lymph node. So there is pre-laryngeal in front of the larynx, pretracheal in front of the tracheal, and then there are lymph nodes which are on the side of the trachea. And here is recurrent laryngeal nerve. What is this? Recurrent laryngeal nerve. This is going upward. Recurrent laryngeal nerve. These parathyroidal lymph nodes, these are on the around the, what is this? Recurrent laryngeal nerve. It passes on the back of the recurrent laryngeal nerve. It is moving superiorly, passes on the posteromedial aspect of the thyroid, in between the groove, a groove which is in between the trachea and the esophagus. Here is in the front there is thyroid, behind that there is trachea, behind that is the esophagus. Now recurrent laryngeal nerve is going up. It goes behind the thyroid and it is moving in the groove between the trachea and the esophagus, and around this nerve there are paratracheal lymph nodes. Why I am specifying or stressing the relationship of these lymph nodes with recurrent laryngeal nerve? Because it is not really some romantic relationship. It is some very important thing for us, that if there is thyroid cancer or you are doing thyroid surgery for any reason, and if this cancer spread to parathyroid lymph node, and if you are removing the parathyroid lymph node, you have to be very careful that don't damage or injure the recurrent laryngeal nerve, because if while removing paratracheal lymph nodes, if recurrent or while removing the thyroid gland, if you are doing total thyroidectomy, if you damage the recurrent laryngeal nerve, if it is damaged on one side, you will develop stridor, because recurrent laryngeal nerve supplies most of the intrinsic muscle of larynx, and especially which moves the vocal cords, When one recurrent laryngeal nerve is damaged, vocal cord is paralyzed in medial position, right? And then there is problem in speaking, and there are inspiratory, when you take inspiration, there are noises which are called stridor, stridor, S-T-R-I, stridor, right? If recurrent laryngeal nerve is damaged, right, on one side, then there is respiratory difficulties and also phonation problem in speaking, and some noises are there, inspiratory noises which we call stridor. But God forbid, if during thyroid surgery, especially when total thyroidectomy is done, and if both recurrent laryngeal nerves are damaged, of course it happens these days very rarely, but if this rare unfortunate thing happens, there's a big problem, because then both vocal cords will get paralyzed in medial most position, in inner position, and breathing is hampered, and you have to do sometimes urgent tracheostomy to provide an airway, right? So again, come here. I was talking about this group of lymph nodes which are central group of lymph nodes which are medial to the carotid arteries, below the hyoid bone, right? That should be here, hyoid bone, and above the manubrium, this notch, manubrial notch. Topmost is in front of the larynx, lower part of the larynx, which is made of cricoid cartilage. It is called precricoid lymph node, or it is called prelaryngeal lymph node, or it is called Delphian lymph node, right? Then there is pretracheal lymph node, then there are paratracheal lymph node, and if there is any other parathyroid lymph node, all this group is called central cervical lymph nodes. What are all these called? Central cervical lymph nodes. So there's no place here. Okay, we can write it here. That here I put central cervical lymph nodes, right? Prelaryngeal, pretracheal, paratracheal, and paratracheal are in very intimate relation with recurrent laryngeal nerves, right? Yes. These lymph nodes are important, especially for thyroid cancers, especially which thyroid cancer? Papillary carcinoma of thyroid, not follicular carcinoma of thyroid less commonly, and also medullary carcinoma of thyroid. I just remember that papillary carcinoma of thyroid is from follicular cells of thyroid. You know, thyroid has follicles which make the T3, T4 thyroid hormone. Now from here the cancer which come from these follicular cell, if they become malignant, most commonly they make papillary carcinoma. I will give a full lecture on that. Then less commonly they make, which one? Medullary? No, not medullary. Follicular carcinoma. And thanks God, least commonly they can make what? They can make highly anaplastic or poorly differentiated carcinoma. So follicular cells of thyroid can make papillary carcinoma, which loves to go to the lymph nodes. Then they can make follicular carcinoma, which loves to invade the venous system or bloodstream, and they hematogenous spread. Then there is highly anaplastic carcinoma, which can also take origin from follicular cells which are totally undifferentiated or poorly differentiated, that can go to both pathways, lymph nodes, central lymph nodes, and from there it can even go to other lymph node group in cervical area, we will discuss later. And papillary carcinoma prefers this. Then there is another carcinoma which is called medullary carcinoma. Medullary carcinoma is not from follicular cell. Medullary carcinoma is from cells which are parafollicular cells or C cells. These are special cells which are outside the follicle, right? These are also called C cells. The C cells actually produce calcitonin producing cells. If these cells become malignant, the malignancy is called medullary carcinoma. This medullary carcinoma love to spread to lymph node and also to hematogenous. So about thyroid cancer, what did I tell? First of all, I was telling it loves to spread initially. If it is going to spread to lymph nodes, then initially it spread to the central lymph node. And out of the central lymph node, it loves to go first of all to the Delphian lymph node, which is pre-laryngeal lymph node, but it can also go to the pretracheal lymph node, paratracheal lymph node, and then spread to other lymph node. Most commonly papillary carcinoma, not follicular carcinoma, but medullary carcinoma can also spread to lymph node and hematogenous both, and anaplastic carcinoma can go to the lymph node and strong local tissue invasion and also to the hematogenous spread. Let's cut the clutter and make it clear. First of all, papillary carcinoma loves to prefer to spread through the lymphoid pathway. Then follicular carcinoma prefer to spread through hematogenous blood pathway. Then medullary carcinoma love to spread by both lymphoid and hematogenous pathway. Then highly anaplastic thyroid carcinoma loves to spread by all possible pathways because it is highly anaplastic and very aggressive, and it has strong invasiveness. It loves to go through lymphoid pathway and also to hematogenous pathway, and also it invades lot of local tissue, right? So this was about central group of lymph node. Just names. What was this? Submental, submandibular. These are superficial group, right? Which was along the inferior jugular vein and external jugular veins. Then superficial cervical. After that, deep cervical along the internal jugular vein, which is upper group, middle group, and lower group. In upper group, most important was digastric. In the middle group, most important was omohyoid lymph node. Then there's lower group. Then we go to the lymph node in the posterior triangle. Upper part, lymph nodes along the spinal accessory nerve. Lower part, many lymph nodes, but lower most part is supraclavicular lymph nodes. And when we talk about supraclavicular lymph node, you must remember there is a difference in the right supraclavicular drainage of lymph and the left supraclavicular. Left supraclavicular has a very special lymph node which is called Virchow lymph node, and if it becomes enlarged, it is called Troisier sign and Troisier sign. I don't know why I miss it, but anyway, you remember trouser sign, right? It is better than not remembering it, right? And this person, if this is Virchow lymph node, if it is enlarged, firm, fixed, non-tender, it is dangerous. It might be some cancer. Patient might have some cancer, and that cancer might be at the stage 4, right? Then So this is importance of this. So after that, I came to central lymph node. Central cervical lymph node, uppermost group was pre-laryngeal, then pretracheal, then paratracheal, right? Then the last group of cervical lymph node that many authorities include the superior mediastinal lymph nodes as a part of cervical group of lymph node. Which? Superior mediastinal lymph node, which are behind the manubrium, right? And this superior mediastinal lymph nodes, right, they are in between the pleura of the both lungs, right and left, above sternal notch, below manubriosternal angle, or behind angle of Lewis. So this superior mediastinal lymph nodes, which are present, yes, there are large vessels there, and there is trachea also. So trachea and large vessels, especially arch of aorta, around this area, the lymph nodes are called superior mediastinal lymph node. I will not go into all their drainage area, but I must mention that many cancers of the, what is this, neck, especially lymphomas from here, or even thyroid cancer, can drain into superior mediastinal lymph node. That was the last group, right? So how many group? There we have finished the lecture on traditional anatomical classification of cervical lymph nodes. I have not discussed the lymph nodes of head, right? I have not discussed parotid lymph node or preauricular lymph node, or I have not discussed the occipital lymph node, right? I have not discussed pre-mastoid lymph node. I have not discussed things like that or other lymph nodes. I have discussed mainly main groups of lymph node in the cervical area, right? Traditional anatomical classification in 1 minute. What is this? Submental, submandibular, then superficial, pericervical, then deep cervical and jugular lymph nodes, upper group, middle group, lower group, then posterior cervical lymph node, especially their lowermost lymph node, which are supraclavicular. Don't forget the varicose, and then central group, and don't forget the Delphian, right? That is in front of prelaryngeal, and then pretracheal, then paratracheal, and lastly superior mediastinal lymph node, right? This closes our discussion on traditional anatomical classification or traditional anatomical placement of cervical lymph node. Now we will continue with the 7 levels of Robin's classification of cervical lymph nodes. This is the modern classification, and according to this classification, which I will teach you now, according to this classification, this is used, number 1, to detect the spread of the cancer in cervical region. Number 2, if you are planning for dissection of the neck or surgery for the neck, you must know this, and if lymph nodes are involved in that surgery, you must know these 7 levels, right? Then these 7 levels also are used by radiologists with little modification. Okay, let's go for that.